Hello everyone, welcome to Aster-Care Arena. It's me, your pharmacist, Adamaka. Today I'm going to be talking on the men's health and I'll be specifying or laying more emphasis on the prostate health. So always pay attention and listen. It's going to be very educating, it's going to be very enlightening.
First of all, we need to know what the prostate gland is all about. It's found in the male body and is the gland essential for fertility but not for erection. Most times it enlarges with age. This prostate gland is about the size of a walnut. We all know walnut is about that size and it sits at the base of the penis. It surrounds the urethra, that is the tube from which urine comes from, what it surrounds. But today I want to talk more on BPH. This BPH is what we call the benign prostatic hyperplasia. You can also refer to it as benign prostatic hypertrophy or benign prostatic obstruction. They are the same thing, they mean the same thing. This BPH is a condition in men in which the prostate enlarges and is not also cancerous. So it's possible that the prostate gland will enlarge and it will not be cancerous. So for that, you need to know that all enlarged prostate is not due to BPH. Prostate can enlarge one as a result of BPH, as a result of prostatitis, that is inflammation of the prostate, or as a result of cancer. These are possible things that could cause the prostate to enlarge. More so, this enlargement of the prostate is not still clear. It is unclear. No one can really ascertain what causes it, but mostly it's part of aging process in most men. And when this prostate gland enlarges, it can squeeze the tube, that is the urethra. And once that tube is squeezed, it becomes a problem trying to urinate. And one thing is that about half of all men that is about the age of 60 experiences that, but almost all men who have clocked 80, almost but not all, also experiences such. Though statistics has also shown that some 8 out of every 10 men eventually develop an enlarged prostate, whereas about 90% of men over the age of 85 will have BPH. Then about 30% of those men will find their symptoms bothersome. It's not everyone that have enlarged prostate that find the symptom bothersome, but 30% of them finds that. Then we have some common signs and symptoms of BPH. Things like frequent and urgent need to urinate. You will be pressed as if you don't empty the bladder, you pee on yourself. There's increased frequency in urination at night. That is what we call the nocturia. The weak urine stream also occur. That is this stream that stops and starts. You may urinate for a while, it will just cut. After some seconds, it will continue. That is what we call the weak stream. We have dribbling at the end of the urination. We have inability to empty the bladder completely. You see when the prostate is enlarged, after urinating, you feel as if there is still some content left in the bladder that need to be emptied. These are some of the symptoms of enlarged prostate. Though there are other symptoms, but they are less. Things like urinary tract infection, inability to urinate completely, urine in blood. These are less symptoms. Some people don't even experience such symptoms for them to know they have BPH. There are risk factors for prostate. That is things that can increase the chances of one having enlarged prostate. Things like aging. One don't get younger, rather your age increases. So men younger than 40 rarely have the sign and symptom. But 1/3 of men experiences moderate to severe symptom by the age of 60, while about half of them do so by the age of 80. So it's illness or condition that have to do with aging in men. The second one is family history. Having a blood relative such as a father or a brother with prostate problem means you are more likely to have the problem. Not as if you must have it, but the tendency of you going to have it is always there. That's what we refer to as the family history. Diabetes and heart disease, there are also other risk factors that could predispose one to BPH, because studies show that diabetes as well as heart disease and the use of beta blockers might increase the risk of BPH. So these are conditions too that could expose one to such condition. The lifestyle is also one thing that can also expose one to having the BPH. Obesity increases the risk of BPH, while exercise can lower the risk of BPH. So we should also pay attention to the kind of lifestyle we live. Ensure one is not obese. You can check your body mass index and know what your body mass index is to ensure that you are not obese, so that it doesn't expose you to BPH. It doesn't increase your chances of having BPH. Once one have this BPH, there are some complications that could occur, like urine retention. That's a sudden inability to pass out urine. It occurs, and when it happens, some men may need tube, that is what we call the catheter, inserted into their bladder in order to drain the urine, while some men may need surgery. Another complication that could occur is what we call the UTI, that is urinary tract infection, because most people with BPH finds it very difficult to empty the bladder completely. So when there is inability to empty the bladder, it can increase the risk of infection in the tract. Once UTI occurs frequently, your doctor will be in the best position to decide if you might need surgery to remove part of the prostate or not, once there is frequent urinary tract infection. So also need to monitor your health and know what it's like. Another complication that could occur could be bladder stone. This also occur if the bladder is not emptied completely. It could result to bladder stone. We have what we call the bladder damage. It's as a result of not emptying the bladder completely. So this can now stretch or weaken the bladder over time due to the fact that the muscle of the bladder no longer contract properly, making it difficult for emptying. Another complication that could also occur is what we call the kidney stone. The pressure in the bladder due to urinary retention can directly damage the kidney and allow the bladder infection reach the kidney. Though most men with an enlarged prostate don't develop these complications, but there are possible complications that could occur, but most of them don't develop it. If you actually monitor your health, you may end up with just an enlargement without a complication all through your lifetime.
Like I've explained, if you notice and observe this symptom, always try to visit the clinic, try to visit your doctor, lay your complaints, or if possible, a specialist, a urologist, lay your complaints to him or her so that they will follow you and manage you adequately. Please, if you love what I do, kindly subscribe, share my video, and keep watching. Thank you.